Can you hear me now? I can hear you.
I can hear you. Can you hear me?
I can hear you as well. So we finally made it. It's so
Awesome.
wonderful.
Congratulations, City Council President. You've moved a mountain for this one with your team. Amazing.
Yes, we have. We've had to, technology is something you just have to play with until you get it right. And I did see you. I didn't realize you from your profile picture. I saw you when I was on the other page,
Yeah.
but I didn't know how, I couldn't add you. So this is working out well. And for my audience out there, I know you're starting to build. We're going to get started right exactly at 1 o'clock. And I'm so happy to have Dr. Copeland here. So just give us a minute while we get ourselves situated. We got about 3 minutes. So let's see who's watching. Oh, I see a few people watching. Hey, Don. Happy AK anniversary with you yesterday, Sands. We pledged together Alpha Kappa Alpha sorority, and yesterday was our anniversary. So hello, LaDon. And let's see. Ramel, Deshawn. Thank you for watching. I gotta put my glasses on. And Tori V, always. And Catherine Cook. So we've got a few people. Thank you all for joining us. We're going to start exactly at 1 o'clock. We've got, a little less than a couple of minutes. So just bear with us for a minute. And I see you've got Kaiser Permanente in the background. Very good.
Yep. I found a little room with the background, so I came in here. So it looks official.
Wonderful. Give me 1 second, everybody. Oh, I can't do that. Don't want to do that. Let me call it up on my computer so I can see what you're seeing. One more minute, everybody. Oh, it's looking good. I see it now. It's looking good. Everybody knows I like to start on time, but I don't want to start early because then they'll miss it. And we don't want to miss a minute of your time. And I really appreciate you for taking the time. I know everything is busy everywhere.
Well, for me, it's this is definitely the highlight of my week, to kick it off with you and with the City of Atlanta. So it's my pleasure. Thank you.
We're proud to have you. So it is 1 o'clock now. So hello, everyone. This is your Council President, Felicia Moore, and welcome to another conversation with the Council President. As you know, in the last few ones, we have been inviting guests because I know you want to hear everything from me, but a lot of times there are people from the outside of city government and even inside city government that you need to hear from directly that can certainly add perspective to what's going on, and we want to stay connected and be a resource. So I want us to welcome our guest today. She's a special guest, but she's also a wonderful City of Atlanta resident. So we are getting our words from someone who is right here in the City of Atlanta. Her name is Dr. Kate Copeland. She's the Chief Quality Officer and AMD Quality and Safety person at Kaiser Permanente. Most people know that name. I certainly know that name. I am a Kaiser Permanente client, and I want to thank Kaiser Permanente for allowing you to come, having you to come and be a part of this conversation with the Council President. So thank you.
My pleasure, Council President. It's great to be here to serve.
Okay, so let me tell you a little about her, and then we're going to get into some questions because I got a million of them. And so Dr. Copeland oversees varied aspects of the national KP quality aims for the Southeast Permanente medical group, including quality oversight and improvement, population care, performance improvement, medical ethics, and much, much more. She is an internal medicine board certified, a fellow of the American College of Physicians, a certified professional in patient safety, and practices adult medicine at clinic locations across Kaiser Permanente of Georgia. She is a graduate of Emory University School of Medicine and Public Health, and she is a native of Atlanta and still lives here. We'll welcome her, and we want to thank you again for joining us today. So, as you know, everybody is in this COVID-19 conundrum right now, and I'm sure people will have questions, and you can certainly add them. I'll try to ask them before, but I was thinking, and I know I have questions here, but could you just tell me, I think people would like, what is really a virus? We're talking about what is a virus?
Oh, well, a virus is a kind of a germ or a bug. It's an infectious agent. We categorize infectious agents kind of differently. We have viruses as an example. Flu virus is another example, or HIV. And then we also have things like bacteria, like the thing that causes strep throat or some skin infections. So there's some different categories, if that helps answer your question a little bit.
Yeah, and so I've heard, and I like to get into some of the things that I'm hearing people say out there. Some commonly known things or misconceptions. And one of the things I keep hearing people say is that this COVID-19 coronavirus is just, it's no different than the flu. It's just like the flu. So is that accurate?
Well, thank you for bringing that up. We actually hear that a lot. We've heard that a little bit on the news or in some interviews with the public. And some people may have a conception, it's not unreasonable to try and bucket in our thinking about this new coronavirus with the flu. We hear a lot you can have flu-like symptoms like you can with a cold or even with some other coronaviruses. So that makes sense for us to categorize it like something we already know, like the flu. What we're finding out, though, is that it can be a lot more serious than the flu. And we also don't have as many treatments nor preventive aspects like we do for the flu with this novel coronavirus. So, for example, with the flu, we actually have a shot that can be pretty effective to work every single year when we take it. And we don't have such a preventive effort like a vaccine yet with coronavirus, so we can't prevent it like that. We also have some treatments for the flu that might be able to work, things like Tamiflu or oseltamivir, some antiviral medications that have been known to work with the flu. We don't have that as yet that's very formally studied and widely available for coronavirus. So in those couple of ways, it's a little bit different. Also, there's no natural immunity yet for coronavirus, this novel coronavirus we're experiencing, since it's relatively new in humans, really in less than a year, as opposed to the flu. We've built up some herd immunity over the years. So those are some examples how it's a little bit different. In some people, you might experience similar symptoms like the runny nose, the sore throat, the fever, the body aches, the fatigue. Those things might be similar, but then we're finding actually that it can advance to more serious illness in this novel coronavirus than we frequently see in the flu. And in fact, I pulled a couple of numbers for you just in case you asked a flu-related question. For the state of Georgia, in 2017, I believe we had about 1,400 flu or pneumonia-related deaths in Georgia. And already we've had a little bit more than that just in the past few months, not in the entire year, for the novel coronavirus. So we can see that it has very serious, and in some cases, although rarely, but in more cases than the flu, it can have a fatal side effect.
And so the flu, everybody can get the flu, kids, older people, young adults. Well, what are we finding with COVID-19?
Thank you for asking. We think also anybody can get it, like you're saying with the flu, and like with the old known coronaviruses that can cause colds, really anybody can catch it. What we're finding to be different is the level of sickness people might get with it, and so much to be learned. There's so many studies across the globe, more to learn, but we're finding that a number of people might be asymptomatic, and we don't know if that's the case for influenza. We think more people are symptomatic. It might mean that you might be exposed to or catch the virus, like we were talking at the beginning, but you might not get really sick with it. Not everybody across all ages might get really sick with it. So it's possible you could catch the virus, coronavirus, this new one and actually not have symptoms of it, all the way to you could catch it and get very ill with it. But certainly to your question, anyone with any level of illness, any age, any race, any ethnicity, any gender is at risk of catching it. The difference in risk is how sick somebody might get with it. So what we've heard is that as people get older, so age can lead to a higher risk of severity if you've caught it, as well as people with chronic illnesses, chronic medical conditions can predispose you to a higher risk of symptoms.
What's going on with children? I've been seeing something in the news about children and COVID.
Yeah, that is in the news a lot, isn't it? And we all get really worried when we hear anything that can affect our children, our community's children. We view them as a very at-risk and vulnerable, section of our community, of course. And many of us, I'm sure, who are listening and who are here are parents too, and so we care deeply. The evidence is a little bit out on that. We, have had many months of exposures of children across the globe with coronavirus 19. And have not seen very large volumes of kids getting very sick or being in the hospital or mortality. That we have not seen over the past many months across the globe. What we're hearing in the news, though, are sort of concerning reports of much smaller volumes of cases here and there, but definitely reported through hospitals and medical journals about a kind of multi-system inflammatory response that's similar to a couple other responses that we've seen in kids before in response to a virus or an immune response. And we're trying to learn more and more about that. I guess the key message here is that we want to be very in tune with that, take a lot of precautions like we would otherwise with our kids as a vulnerable population, but it's not to inspire mass fear. These are not high volumes, and we're still trying to learn a lot more about that.
So here's another question. Is there a cure for this? Because I have seen on the internet all kinds of things. Some things are talking about people, and all of the variety of things that you need to do to boost your immune system. I've seen where if you take a blow dryer and do something with it up your nose, the heat kills it that's trapped in your sinuses. Mm-hmm. I mean, all different kinds of myths. So can you address any of those?
Yeah, thank you, Council President, for bringing that up. We did want to do a little bit of myth busting during the session, so I appreciate bringing that up. We want to be as evidence-driven and fact-based as we can, for sure, as a community here in Atlanta and in the medical community. We want to support that. As of yet, there is no known cure. There is no known, fully effective treatment or cure that's out on the market, period. However, many studies are underway to look for therapeutics that might help. We're looking at different classes of medication. They could be antiviral, they could be immunologic, they could even be radiation therapy. So definitely we're looking into different cures right now. There are no known cures, nor even preventive things. Could be, additional vitamins I've heard in the news, but nothing's been proven about that. Certainly nothing about a blow dryer. Certainly we don't want to be advocating for anything that might even be dangerous, not even helpful, but potentially dangerous. So things like ingesting bleach or cleansers, we know could actually have a toxic effect, especially on children. So we're very concerned in the medical community and in our community in general for the safety of our children and our citizens. So we'll be tracking on those developments for sure. Thank you.
So the other thing, and I'm a news junkie, so I'm just hitting you with all the things I hear in the news. And so there's been a lot of talk about a second wave, and the concern about this second wave because it may come around the time that we have the normal flu symptoms. So what should we be doing, or what's going to happen with that? How are you going to tell if it's the flu or if it's COVID?
Exactly. So this is what we're all going to be faced with, we think, in the fall. So what we're thinking and hearing from the national COVID experts is that there could certainly be a resurgence in the fall of COVID-19. And this is for a couple of reasons. One reason is we've all the communities, especially in our country and locally here in the state and in the city, have had a lot of tight mitigation efforts, which we've all experienced, right? The home isolation and the social distancing and sheltering in place, right? And all of the virtual work. So that's been really work to flatten the curve and keep infections at bay. as we release some of that or go into the new normal, there's a possibility for a resurgence. So that's thing number one. And thing number two is that like the natural course of some of these kind of viruses, and if this acts like a seasonal virus, like typical cold viruses or the flu, we do tend to see the worst of it in the fall and the winter. We're indoors more, the weather is colder, those sorts of things. So those are kind of like a double whammy, if you will, on top of what you mentioned, the flu. The seasonal flu starts to hit us kind of late summer, early fall, August, September timeframe. And your point is exactly what we're trying to plan for and think through. You know, a patient might call in with symptoms like a fever and body aches and a cough. And how would we know, you know, right, just on the phone between if that's a flu or COVID? So a few thoughts. Number one is we're getting our testing capacities up to speed, right, in the state for COVID. And so I think we'll be able to help with some testing, maybe to tell the difference. Also, which of these do we have a vaccine for right now? Flu. And so while it's not 100% effective every single season, it's shown to be one of the most effective public health interventions ever. And so we definitely recommend to anybody and everybody that's able to get the flu vaccine, the seasonal flu vaccine, get that early, tell your friends, tell your colleagues, tell your family. And this should be the year where Georgia just knocks it out of the park on our flu vaccine, since we have a lot of room to go, so that we can help differentiate and protect from what we are known to be able to protect from, which is the flu.
So you want me to come and get my flu vaccine, and I'll tell you, Kaiser's good about making sure you get that. But you know what? I am kind of weary about even coming to the doctor. So some people are going to be a bit leery because, you know, you never know if COVID infected people have been there. So help me out with that. Help get me to come in and get my flu vaccine or even my routine checkups.
Okay, well, let's talk about, for flu vaccine, I wish we could give it to you through the phone or through a video, but we haven't perfected that technology yet. Maybe somebody's working on it. So there's definitely certain things in the medical sphere that you will need to come in and receive in-person care for. Immunizations are one of those kinds of things. There's some other reasons we need to see you in person for certain cardiac evaluations or other kind of urgent evaluations. And then there are some things that are more for discussion or for video or that we can do via routine virtual care. So to address both, for the shot itself, I want to answer your question right up front. And not just Kaiser Permanente, although we believe we're leading in this way, but everyone in the market, all of the healthcare facilities in the market should be following, you know, the kind of physical distancing, and everybody wears a mask. That's called universal masking, and very frequent environmental cleansing activities, and all of those kinds of new workflows and processes that the rest of the market is seeing now, but healthcare facilities have very well in place to protect members, right, and patients, as well as staff. We want to protect all of our staff equivalently. So the stakes are high for all of us, and we are doing absolutely everything that we know to protect both the patients and any visitors they might have, as well as our staff on site. So those things are going to be masking, again, hand washing, physical distancing, that sort of thing. That's for in person. And we don't want people to delay things they need in person. We don't want to defer care that from a safety and quality standpoint and from, you know, your own needs standpoint, you need taken care of now. So we're ensuring that facilities are as safe as possible along those lines. Those would be things for immunizations as well as for visits. And then we're also offering, as are many providers in the Atlanta market, virtual care opportunities. So for that, which you might not need to come in and physically be seen, then there's opportunities for, you know, emailing your provider's office, telephone visits, video visits, and more. So I hope that answers your question. We can't wait to give you your flu shot when it's out, you and your constituents.
Okay, well, you're making me a little bit more comfortable, but you did mention something that for some reason has become political football. So we're going to throw the politics out of the window, and I want you as a medical professional to really explain and help us understand the issue of wearing a mask. You know, is it important? Is it not important? I go out to my grocery store. It's about the only place I go. And I used to see people with more masks on, and now I see people with less. So could you explain what the whole issue of masking is?
Sure. I'll try to, and then keep asking me questions if you feel like I'm not making a lot of sense. So I think here's the general idea about masking. And I sort of use a little bit of like a scale from sort of less medically stringent masking to the most medically stringent masking. So let's start at the most medically stringent masking. When healthcare providers are caring for, active patients with COVID-19, we want them, say, for example, they're needing to intubate or put a tube down their throat in an intensive care unit. That's kind of like an example of the most active kind of care. We'd want them to be sort of fully garbed with a very strong mask on and eye gear and all of the gear that you might have seen on TV, that sort of thing. We call that personal protective equipment, and there's sort of official infection prevention guidelines. And then dialing it all the way back, we have different levels of risk that we identify, for example, in medical facilities, that we, create medical guidance for that personal protective equipment, PPE. And then let's talk about us in public when we're interacting with each other and the community and within our community. And that's the context. I think we talk a lot about this personal use of masking. So the science behind that is as follows, that it's kind of like a social compact. We have agreements with each other to take care of each other, and then also to especially try and protect our highest risk citizens from the risk of becoming infected, because they could get a lot sicker too. So we kind of have this social compact. That's what the sheltering in place was, and that's what the sort of limited social interactions are. So the idea of masking in the community is that even with the fabric masks, okay, these homemade, the fabric masks, or the sort of non-medically indicated masks that we're seeing folks wear and that are available, the idea is it sort of keeps in our own breath and germs, if you will. If we were infected, we'd be a lot less likely to kind of share what we have within our body if we use our own fabric mask.
Let me stop you, because
yeah.
It makes a lot of sense to me, and I think everybody who's watching has experienced this. If you get close to people, sometimes you can actually see the little droplets coming out of their mouth when they're talking, and sometimes it even gets sprayed on your face. So that's what we're trying to prevent, is those little droplets that come out of your mouth when you're just talking.
Thank you. Exactly that. When you're talking, when you're laughing loudly, when you're singing, or certainly when you cough and sneeze, that expels a lot of those droplets out. But even just talking really loudly, singing, laughing, or talking and even breathing, it can sort of go into the environment. So I think that's exactly the concept. So we mostly are asking people in the communities to wear those masks to decrease, the risk of us spreading anything. It's less known about how much wearing those fabric masks protect the wearer. What we're doing is protecting others. And sort of, it also is a visual cue to remember about a lot of things. It helps remind us about hand sanitizing. It helps remind us about social distancing, and reminds us we're in a little bit of a risky environment when we're out amongst others. So it kind of serves a lot of cues like that. But ask more questions if you need any more clarification.
So is it safe to say that of course, we want to keep the physical distance from people. That's an important aspect. But is it safe to say that if you're in an environment where you have social distance and everybody has on a mask, that will dramatically decrease the likelihood of it spraying in the air? So
if we're having physical distancing 6 feet and the mask?
And everybody
yes.
together, say it's 5 people, would that decrease it because you have some protection? I mean, decrease the likelihood. I'm not saying take it away.
Yeah. I mean, that's the idea. I mean, what we're all in this together is just to decrease the likelihood. So that's a really great way of saying it. We might not ever get to zero in terms of risk, right? Unless we sort of tested negative and flew into space and we're by ourselves. But, we're human beings and we like these social connections and being together and so forth. So we're trying to figure out what are the safest ways to do that, to decrease unnecessary risk. So one way is limiting the number of people in a room. You mentioned 5 people. I think at a certain point we'd said definitely 10. There's different recommendations out there at less than 20. We think, the fewer the better. So like you said, 5 in a room, 6 or more feet apart from each other, is kind of the accepted distance with everyone masked, good hand hygiene, that sort of thing. Outside might even be better because there's more air circulation. We've heard about that. But to your point, whatever you can do to mitigate the risk, which means lessens the risk, is the recommendation.
So everybody, we've got about 10 more minutes with the great doctor here. She's giving us some good information. I'm asking all the questions. If you have a question, don't wait to the last 2 seconds. Now is the time to ask her that question. Yes.
Can I just make one little comment and then absolutely open it for questions? You use the phrase social distancing, and we use that too. That's kind of it. It's a long, no, that's the term. It's a long-standing term. I think it stemmed back from a century ago, maybe even the 1918 flu epidemic. I'm not sure, but it's been around for quite a long time, social distancing. And at Kaiser Permanente and others, we definitely want the physical distancing. We know that has shown to be, to mitigate or lessen the risk, like you mentioned. But we do want to say, mental and emotional health during this time, during all times, is so important. Even before the pandemic, we struggle in this country with emotional and mental health for everybody. And so I just want to call out, this is a time, this is hard for everybody. It's hard to be really distant, especially hard for elders or socially isolated. Of course, for everybody with young kids and that sort of thing. So I just want to call that out for a moment, that social connections, whether it's virtual or safely from a distance or that sort of thing, is still really very important. And to highlight, please note and take care of yourselves from the emotional and mental standpoint, as well as the physical, which we've been talking about today.
And I'm glad you threw the health issue in there, because it is a big adjustment for people to be out, to be more sociable. The biggest thing I miss from people is hugs. I didn't realize I really appreciated just that personal, physical connection. And we do have to be cautious of our mental health. And, this is a great time, if you haven't, to reach out and call people that you haven't talked to in a long time, just to make sure you're keeping that social connection. So I'm so glad you mentioned that. I don't see any questions from anybody. I think we're covering everything. But I did want to know if there were anything that you didn't think that we talked about that people could use as tips to help keep themselves healthy during this time.
Well, I think we mentioned, this idea about masking, I'm glad you brought that up, is important because it also gives us other kinds of cues. One thing that we're getting a lot of questions is about returning to work or returning to school. And so I bet a lot of your constituents and citizens of Atlanta and parents and employees in general have questions about that. So we're just, the kind of advice we're offering is we're trying to align with CDC guidance about different levels of risk for different kind of employees and for schools, and then trying to support the employer groups at what can they do to create a safe environment for the employees, and then what can we do to make sure that the employees are safe too upon returning to work. So if any of you have questions about school or work, I'm open to discussion, but there's no really good answers about that just yet.
Someone asked, how long should masks be worn for children and adults? 8 hours on a job is a long time.
Yeah, and if any of you have experienced wearing them for a long time, it feels different than not wearing a mask, for sure. So we have a lot of experience here in medical facilities knowing that feels like a long time. I think, the idea is this is about risk lessening. So whenever you feel like you're in an environment where it's risky, the goal is to really wear it as much as you can. There's not really a time limit per se. Some individuals, though, might be less able to wear masks for a long time if they have particular medical conditions, respiratory or other conditions. So please, you can discuss that with your healthcare provider if you feel like you have any issues with the mask wearing.
So someone said that there were a lot of large crowds that you probably saw during the Memorial Day weekend, and they said, what can Atlanta do to stop that? Well, that may be my question, but they want to know how dangerous it is to be in and around a large crowd.
I think that's exactly, sorry, my AirPod's falling out. That's the question, is kind of how dangerous is it to be around a large crowd? The idea is that this virus, this novel coronavirus, is quite infectious, and we really don't have herd immunity. So this idea that if you're in a large crowd, a lot of people can be infected just from one infected person, whether they're symptomatic or not symptomatic. And the issue is you don't know who that is. And so this idea, especially if you're indoors and you're around a lot of people less than 6 feet unmasked, the risk is a lot higher. So it is very concerning from an epidemiology standpoint when we see large crowds of people already gathered together without masks and without that kind of protection. We're not certain if there could be spreading within that environment. So from an epidemiologic and medical standpoint, we definitely would recommend, more spacing, more masking, and less of big gatherings.
So I'm going to ask you a couple other quick questions and we're going to wrap up. And I thank you so much for your time. One asked about, do we really think that children are going to be wearing masks in school all day long? That's one question.
And so I have a 5-year-old. I'm going to turn that right back and ask, can you imagine that they're all going to be wearing it all the time? And so the answer is probably they probably can't wear it all the time. But we can create an environment where they can wear it a lot of the time. My child's ex-daycare, actually even today, they're having a few little learning sessions for the kids to teach them about masks and the importance of it, and the parents can help with that messaging too. So I think schools will have to retool their procedures around number of kids in the classroom, around how frequently they sanitize, around their rotation of toys, around really, really, really strict, don't come to school if you're sick. That goes for work also. Do not go to work if you're sick. Do not go to school if you're sick, until you sort of get evaluated by your healthcare provider and determine that. So those are some important rules about returning back. But, it's sort of like how much can we lessen the risk? So your kid might not wear a mask for 12 hours, but if you get them to for as many hours as you can, that's probably still helpful.
So my question, and then we're going to wrap up, is, this issue about takeout versus in the restaurant dining, now that the restaurants are open. Do you have any tips on that?
And again, I don't want to go into the political or financial landscape about that too. I think, we're still very early in the pandemic, really. It's only been a little bit over 3 months. And we thought maybe, we reached a little peak here in Georgia, I believe in sort of early to mid-April, depending on how you count. And then we've sort of seen some effective flattening. One of the reasons for that flattening was to have a lot less people indoors without masks on. And so what we just want to continue to maintain is just, use your common sense, which you all have a lot of, and try and limit the amount of risk in terms of indoors or packed, environments that you're in, or times when you're indoors and close to people not wearing a mask. And so outdoors tends to be better than indoors. Large amounts of separation, times when you can wear your mask the most is what's recommended still for this time until we see the direction we're headed in here in our community.
Well, thank you. And I'm going to give you the wrap up, but I want you to tell us in your wrap up, because you mentioned one thing that's very important is that we get our flu shot. And so tell us, when is the soonest we should be thinking about getting that? And then tell us anything you'd like to wrap up. And thank you so much for your time.
Yeah, well, thank you. Main thing is thank you so much for hosting us. It's great to be able to share a conversation with you and answer your FAQs as you will from yourself and your constituency. So thank you on behalf of myself and Kaiser Permanente for hosting us. Number 2, yes, get your flu shot. Let's make this the best flu season ever for the state of Georgia. I think we can do it. If we don't use this as an impetus, I'm not sure what we would do. Usually the earliest is the end of August and early September. So keep your eyes peeled for around then, and encourage you, your family members, friends, colleagues to get that. I guess 2 more main messages. The message of optimism and hope is that, time passes. We have amazing medical and different public health capacities and new discoveries happening all the time. And so we're going to continue learning more and more about this pandemic and the ways we can prevent it and treat it. So that's a hope of optimism. And this too will pass. A year or 2 or 3 will happen. And hopefully we'll continue to learn with each other, protect each other, and maintain our social compact and our commitments to one another, and grow through this together and be stronger for it. So that's a message of optimism. And I would just add to that a message of just continuing to use your common sense and your caution. We're not through the thick of this yet, and we need to continue to protect ourselves and our loved ones in our community. So as many of the public health sort of suggestions and recommendations we're offering for guidance for prevention, we'd encourage you to continue to try to comply with.
Well, thank you so much for your time. And we may have to have you back because, like you said, we're still in the thick of it. And there may be new things that we learn from this new coronavirus. And thank you so much. And thank you to Kaiser Permanente for lending you. So we'll see you again, maybe.
My pleasure. Okay. Thank you. Okay. Bye.
Let's see. I'm going to just continue to wrap up here, and I just want to tell everyone to make sure you fill out your census forms. It is extremely important. We've reached over the 500,000 population mark, and that's good because that puts us in the category of larger cities that enable us to get more funding from the federal government and many other things. But we need you to be counted. So please, if you have not filled out your census, you can do it by phone, you can do it by mail, you can do it online. So please make sure you fill that out. Also, we are in voting season. Early voting is open. I know many of you have applied for your absentee ballot and may not have received it. They should be coming this week. So please be patient. If you do not want to go to the early voting booths, I appreciate that. So I want to wrap up right now because we have been at a couple minutes past our time frame. I want to thank you all again. Thank Dr. Copeland for her advice, and I'll see you again for another conversation with the council president. Be safe, everybody. Social distance, wear your mask, fill out your census, go to vote. Bye-bye.